Hello friends, welcome back to Complete Medical Coding. Today I am here with some important anatomy questions. Okay, anatomy questions that you might get in your CPC examination. Okay friends, so let's discuss few important anatomical questions today. Before moving to the video, if you are new to the channel, please support me by subscribing to the channel. Okay, now let's look into the questions one by one. First question. What is done when a surgeon performs a bilateral salpingo-oophorectomy? Salpingo-oophorectomy. So, what is done when a surgeon performs a bilateral salpingo-oophorectomy? Of course, the word bilateral represents both, right? And what is salpingo-oophorectomy means? Salpingo-oophorectomy. Let's see the answer. Yes. It is the laparoscopic removal of both the ovaries and the uterus. Okay, salpingo-oophorectomy. Okay, salpingo represents bilateral salpingo represents both the ovaries. Oophorectomy. Ectomy means removal. So uterus also. If it is only oophorectomy, it means removal of the uterus. Okay. Now second question. Spleen is part of which organ system? The anatomical organ spleen. That is part of which organ system in the human body? Is it digestive? Is it respiratory? Is it cardiovascular? Is it reproductive? Lymphatic? What will be the answer? Of course, spleen is part of the lymphatic system, the lymph nodes, the lymph. There are blood vessels as well as lymph in the in our body, right? So that lymphatic system. So spleen, it is a part of that lymphatic system. Okay, so lymphatic system is the answer. Spleen is part of lymphatic system. Now moving to the third question. A patient is going to have placement of a myringotomy tube. Okay, myringotomy. This tube is placed in the dash to drain excess fluid. So, myringotomy tube. So, what is the use of myringotomy tube? It is used to drain the excess fluid. But where is this myringotomy tube placed? That is what our question is. Where is myringotomy tube placed? Myringotomy tube is placed in the ear. So, it's a part of ear. Okay. So, myringotomy tube which is present in the ear. The function of myringotomy tube is to drain the excess fluid that is present in the ear. So, in order to drain the excess fluid, or in order to drain and remove the excess fluid, myringotomy tube is present. Okay. Now, let's see the next question. Fourth question. What are phalanges? Those who are into anatomy or those who are from science background, they must be knowing what are phalanges, right? Phalanges. It is what it is. Let's see the answer. Okay, those who already knows, just wait for the answer. Let's see what it is. So, what are phalanges? Phalanges are the bones found in both the hands and the feet. The bones that are found in both the hands and the feet. The fingers. Okay, the bones present in both the hands and feet. In the fingers especially. Okay. Not fingers, sorry, hands. Bones present in both the hands and feet. Now, next question. Fifth one. The provider documents that the patient is having pruritus. What does this mean? What is pruritus represents? What do you mean by pruritus? Have you heard about this term before? I had already done few or anatomical chapters before. You might get it from there as well. Still, let's see the answer. What do you mean by pruritus? Pruritus means localized or generalized itching. Okay. Localized itching means any specific part, itching in any specific part. Generalized itching. Generalized itching means itching all over the body, whatever it is. Whether it could be a localized itching or it could be a generalized itching, that is called as pruritus. Okay. Now, sixth question. This is an important question. What is the difference between entropion and ectropion? Entropion and ectropion. In many of the CPC examination, you will be getting something related to entropion and ectropion. So, what is the difference? Entropion and ectropion. This is something which is related to the eye. Okay. So, let's see what is the difference between entropion and ectropion. Entropion means inward turning of the eyelid. The inward turning like this. Inward turning represents entropion. And then ectropion represents the outward turning of the eyelid. The eyelid, if it is outwardly turned, that is called ectropion. If it is inward turning of the eyelid, it is called as entropion. Okay. Now, next question. What type of graft is used when pig skin is applied to a burn wound? Suppose there is a burn wound. Okay, there is a burn. The patient who has come for the burn dressing and then the patient requests grafting. So, what type of graft is used when the pig skin from a pig is grafted? That is what the question is. Okay. So, what is the answer? That type of grafting which is getting from the pig skin of the pig, and then doing that grafting where the burn wound is present. That is called as xenograft. There are different types of grafting. I had already taken grafting chapter in the initial episodes. Those who are new, you can refer my starting videos. You will be getting that. Okay. So here pig skin graft is known as xenograft. Now, eighth question. This is a very simple question, but it's common. Okay. Usually everybody is asking. Fracturing the acetabulum involves what area? Acetabulum. So you should be knowing where is acetabulum present. Okay. So fracturing the acetabulum fracture, that involves what area? Which area this is affected? That is what the question is. Let's see the answer. It is the pelvis. So fracturing the acetabulum is in the pelvic area, pelvis, pelvic girdle. Okay. The acetabulum is present in the pelvis, pelvic area. This is important. Okay. But it is, maybe everybody knows this one. Anyway, let's move to one more. Let's move to few more questions. Ninth one. When a patient having a tenotomy performed on the abductor hallucis muscle, where is this muscle located? Tenotomy. Otomy means repair. So when a patient is having a tenotomy performed on the abductor hallucis muscle, the question is, where is this abductor hallucis muscle present? Abductor hallucis muscle, where is it located? It is located on the foot. Abductor hallucis muscle is located on the foot area. Okay. So that is what it is. Now let's I'll discuss one more question, 10th question, and again I will be coming back with more anatomical questions as well. Let's see one more question. What is the term used for inflammation of bone and bone marrow? Inflammation of bone and bone marrow means what? Or what is the medical term that is used to describe the inflammation, okay, of bone and bone marrow? This is a common question as well. But it is simple. Yeah. What is the medical term for bone? medical term for bone is osteo. Okay, osteo is the medical terminology which is used for bones. And then inflammation of bone is the question. So, what is the medical term used for inflammation or swelling? That is called itis. Inflammation, the word inflammation or itis or swelling. That is called, medical term is called as itis. So, the inflammation of bone and bone marrow is osteomyelitis. So, that's it, friends. That's it for today. Few anatomical questions. Okay. So, hope you understood or hope you like the video. If you're new to the channel, please subscribe and please like and share it among your friends. I'll be coming back again with more and more anatomical questions and more questions. Thank you so much and stay tuned. Bye. Take care.